Hello, good evening, everyone. How are we all doing today? You are welcome to this Health Talk, and I'm going to be talking briefly on the causes of vaginal atrophy. Vaginal atrophy is a condition that normally causes the lining of the uterus of your vagina to become drier, thinner than normal, and this condition normally happens as a result of reduction or a decrease in your estrogen hormone. And estrogen is our female sex hormone that control every aspect of our health, even to our ovarian health. So during menopause, your body make less estrogen as a woman, or even when you are in your perimenopause, when you are not even in menopause. Due to decrease in this estrogen, your body system will work different than the normal way. So without estrogen, as you know, the lining of your vagina can become thinner. It can affect the lining of your vagina to become thinner and become less elastic, and even reduce the moisture content, that is your vaginal fluids. So your vaginal canal can also narrow and become shortened as a result of reduction in estrogen. So also know that estrogen also can also become reduced or become lower in the amount of the natural vaginal fluid and the mucus that you have, and it can also decrease your acid balance in your vagina, which can also prone to some UTIs and infection, recurrent infection that you are also experiencing. So there are so many things that can increase your risk of this vaginal atrophy aspect that can cause it, because one is because your body is not producing enough estrogen, and also this estrogen, it makes your vagina to become delicate and more softer and more still, and also makes sexual intercourse more pleasurable. But a reduction and decrease in this estrogen can make it to become drier, irritated, and even inflame it, leading to itching, burning sensation, and other. And this condition can begin to decrease your interest for sex. So your body, can also produce less estrogen during events other than menopause. There are so many things that can also lead to decrease in this estrogen, especially if you are a female, if you are a woman assigned female at birth, you are at a higher risk. And also if you are a breastfeeding mother, because during the process of breastfeeding, your body produces less estrogen. This can also cause problem to have in this vaginal atrophy. And also conditions that can involve or removal of the ovary, like cancer, all this can also cause someone to begin to experience vaginal atrophy, because definitely your body will not be producing enough of this hormone. So who are those people that are higher risk? What can raise your risk of this vaginal atrophy? Because being a woman is one thing that raises your risk, because you have a vagina, and so definitely you can be prone to this condition. And also during menopause, if you are a menopausal woman, you are definitely going to have it can also raise your risk of this condition as well. So because your body naturally produces less of this estrogen during your menopausal transition, definitely can cause you to have this issue. There are other factors that can also cause it or lead to decrease in your estrogen that will lead to this vaginal atrophy, and this include decreased ovarian functioning, where your ovaries is no longer functioning in the normal way that it's supposed to. And this can result when someone undergo treatment that involve chemotherapy or radiation therapy. Other medication that also contain anti-estrogen properties can also interfere with your body, and also any condition that involve removal of the ovary can also be a factor that can also raise your risk. Also, some birth control pills that we use are there Not all birth control pills are very suitable for you, and that is why when you are considering taking birth control pill, you need to work hand with your doctor to give you the right one that will best suit you. And also, if you are one that is having immune disorder, when your immune system is not functioning well, it can also raise your risk. Also, a woman that smoke, or if you are not smoking but you bring in or you take in this secondhand smoke from tobacco or other sources, it can also affect your ovarian function. So people who also have penetrative sexual activities less often can also make them to have a higher risk or moderate to severe vaginal atrophy, because study shows that people who engage in frequent sexual intercourse, they have a milder case of this vaginal atrophy compared to people who stop having sex. This has to tell you that having sexual intercourse frequently can lower your risk of this vaginal atrophy. Why? Because during sexual intercourse, even during the stimulation mode, sexual stimulation increase blood flow into your vaginal wall and make your vaginal tissue more elastic. So if you have this condition, please, you don't need to keep it to yourself. Reach out for support, and you will be able to go or manage those symptoms that are accomplished by this condition and live a fulfilled and well-deserved life as a woman. So thank you and have a blessed day. Bye from my side.